はい、じゃあ、It's time to start. おはようございます。はい。じゃあ、Let's start today's class. Today's class is open from the, this is a present phrase ね。started from the fundamental biological body and the bioengineering facilities and the sensors and the cell, muscle, actuators. To replace the vessel in place of the muscles, and blood cardiac system, cardiovascular system, and biomaterial because blood makes the clot easy inside of the blood vessels, and then the heart and the human death and organ transplantation I have discussed last year. So today and the next week, some alternative method of organ transplantation we discuss. はい、じゃあ、どうですかね。Today's part is divided into three. Okay. The first part is heart disease, and the second part is two medical technology about the treatment to prevent from the brain death conditions, and finally about the regenerative medicine. So the firstly started with this. The heart attack. Heart attack is mainly the caused by this blood is not provided to the heart. So therefore some part of the heart muscle will become weak or become dead. It is said that IHD with ischemic heart disease. Because of the coronary artery to provide the blood to the heart muscles, it's become narrow or obstructed to prevent from the blood flowing. So therefore the blood is not supplied to the muscles. So therefore some part of the heart muscle become weakened or partially dead. So therefore the PTCA, the percutaneous transluminal coronary angioplasty. From the inside, the blood clot is made. So this blood clot is prevented, is released, or from inside the blood artery is expanded, and then the blood flow become produced again. 5. The X-ray observation. It is using the catheter, some wire devices using, and then various devices is provided from inside of the vessels. The one is drug is provided to mediate this blood clot, and the balloon method and the stent method is the next slide showing. And the bypass graft. Bypass graft is the medical operations to some supporting the bypass blood vessel will be provided. Some other blood vessel is picked up from other organs, and then it is used to supporting the blood flow as a bypass. This is the heart is while stopping, or this heart operation will be reduced. So therefore, some other method stabilizer is to weaken to reduce the heart movement, and also some other pumps is used in place of the natural heart. ちょっとなんか見ますか? Overview of coronary artery disease.
The heart is fed by its own circulation, known as the major coronary arteries. These arteries include the left anterior descending artery, the left circumflex coronary artery, and the right coronary artery. The bloodstream contains red blood cells, which deliver oxygen to the heart muscle, known as the myocardium. It also contains fats or lipids, known as low-density lipoproteins, or LDL cholesterol. Atherosclerosis begins when LDL cholesterol accumulates in the arterial wall, forming a plaque. Over time, the plaque becomes larger. Some plaques never obstruct the coronary blood flow. The patient with asymptomatic coronary disease has no chest pain and no myocardial ischemia. A plaque can enlarge to the point that the blood flow is compromised. The patient may have chest pain, but only with exertion. This syndrome is known as stable angina and is not a clinical emergency. Such a patient is still at risk for an acute life-threatening event because a plaque can suddenly rupture, causing clotting of the artery, known as coronary thrombosis. When a thrombotic occlusion is subtotal, an acute coronary syndrome develops, and there are two types. The first type is known as a non-ST segment elevation myocardial infarction, and the second type is known as unstable angina. With these syndromes, the patient experiences chest pain at rest, and the electrocardiogram shows ST segment depression. In contrast, when the thrombus completely occludes the vessel, the myocardium is injured, and the syndrome of ST segment elevation myocardial infarction develops. In summary, patients with coronary artery disease may be asymptomatic, they can have stable angina, or they can suffer an acute atherothrombotic event. Plaque rupture with coronary thrombosis is the most common cause of acute, life-threatening coronary artery disease. Emergency therapy by thrombolysis, angioplasty, or thrombectomy restores blood flow by targeting thrombus, either dissolving it, displacing it, or removing it as quickly as possible. Rapid restoration of blood flow reduces symptoms and minimizes myocardial damage.
ということで、まあいいや。ということで、まあ、firstly, the medical treatment first は some drug, the intracoronary thrombosis っていうので、some blood is まあこれはtotal body に some the drug is injected, or the using the catheter and the replace this catheter place this catheter inside of this vessel, and then the drug is provided to mediate this thrombosis. ね、っていうので、ちょっとこれもうちょっと見ますか。
I'm Peter Entrop. This is the first mechanical transcatheter recanalization in STEM. I performed it on July 12, 1978 in a 39-year-old hemodynamically unstable male patient with an acute anteroseptal infarct. IABP was initiated. Angiography 2 hours after symptom onset revealed a total LAD occlusion without collaterals.
まあ、オクルーデッド。
I placed the Shirey catheter subselectively into the LAD and crossed the occlusion with a wire. LAD flow was restored through a small channel. The patient stabilized and was discharged on Coumadin. Repeat angiography several months later documented significant luminal improvement, which we attributed to endogenous thrombolysis.
というわけです。これはドラッグですよね。Then second way is balloon is used. This catheter is this is a thrombosis. Blood thrombosis is here, and this is a wire catheter, and the balloon, rubber balloon is here. So therefore, it is inserted here, and the balloon is become larger, and then this thrombosis is there. So therefore, after expanding this vessel, then this is released. So therefore, sometimes it is again narrowing, or some blood vessel wall is broken, some part. So therefore, it is not good enough for the treatment. But firstly, it is tried. So therefore, it is good. The balloon is the liquid is filled inside of this balloon. But the balloon, if it is too small, it's not good. But if it is too large, it makes the damage to the vessel walls. So therefore, it is very difficult to treatment about this size of the balloon. And then if it is released, after releasing it, it is narrowing it again. So therefore, it's not perfect method to make this blood flow keeping. So therefore, this stent method is developed. The stent is made of stainless steel or something, some other metals. So therefore, this metal is covered over this balloon, and if once it is make larger, make big, this stent condition is enlarged and expanded condition is kept. So therefore, it is a semi-perfect method. But of course, this is not the natural material. So therefore, sometimes in some blood clot is made again around these stents. Again, the clot is developed again, and blocked again inside of this. ちょっと見ますか、どうかしら。これか。これナレーションがないからダメです。ここの場所ですね。90% ブロック書いてあるんですけど、そこにステントを入れて、このカテテとバルーンでステントを入れて、でここにステントを置きましたよと。placed。30mm ロングのステントをここに入れて、で、こうバルーン is expanded. Then after releasing the stent, this opening part is kept. っていう話ですね。はい、です。Expanded stent is placed. Blood flow is increasing through the artery. Yes. ということで、だけど、this kind of, in this method, this plaque or blood clot is located, remained inside the artery. So therefore, this part is flowed, or sometimes flowed, and more narrow vessel will be closed. So therefore, this plaque or blood clot should be erased or should be vacuumed. So therefore, this method is developed. This is a cutter, rotary cutter is here, and this blood clot is placed here, and this cutter is working through it, and then it is cut it, and through inside of this pocket, this blood clot is stored, and it can be released inside of the body, from inside the body. This method is shown here. Directional coronary.
DCA, directional coronary atherectomy, like PTCA, is a minimally invasive procedure to remove the blockage from the coronary arteries and allow more blood to flow to the heart muscle and ease the pain caused by blockages. The procedure begins with the doctor injecting some local anesthesia into the groin area and putting a needle into the femoral artery, the blood vessel that runs down the leg. Once the needle is inserted, a guide wire is placed through the needle into the blood vessel. Following this step, the guide wire is left in the blood vessel and the needle is removed. An introducer is then placed over the guide wire, after which the wire is removed. A 35,000th inch guide wire is put in its place. Next, a diagnostic catheter, which is a long, narrow tube, is advanced through the introducer over the 0.035 inch guide wire into the blood vessel. This catheter is then guided to the aorta, and the guide wire is removed. Once the catheter is placed in the opening or ostium of one of the coronary arteries, the doctor injects dye and takes an X-ray. If a treatable blockage is noted, the first catheter is exchanged out over a 0.035 inch guide wire for a guiding catheter, after which the wire is removed. Once the guiding catheter is in place, a 14,000th inch guide wire is advanced across the blockage. Then, a catheter designed for lesion cutting is advanced across the blockage site. A low-pressure balloon, which is attached to the catheter adjacent to the cutter, is inflated such that the lesion material is exposed to the cutter. A drive unit located at the proximal end of the catheter is turned on, spinning the cutter. A lever on the drive unit is advanced by the physician, which in turn advances the cutter, cutting away pieces of the blockage. These lesion pieces are stored in a section of the catheter called a nose cone and removed after the intervention is complete. Together with rotation of the catheter, the balloon can be deflated and reinflated to cut the blockage in any direction, allowing for uniform debulking. A device called a stent may be placed. This is a latticed metal scaffold that is placed within the coronary artery to keep the vessel open. After the intervention is completed, the doctor injects contrast media and takes an X-ray to check for any change in the arteries. Following this, the catheter is removed and the procedure is completed.
とかいう方法が、こっちにバルーンがあって、このカッターにあるわけですね。他にも最近は recently many devices is developed。例えばちょっとこれ見てみますか。サーボボックス。 つけながらこうプラークを削り取って、ここはローリングカッターですね。まあ、こういうデバイスだったり、他にも、これは実際いるやつです。ドリルしながら、これはバッキュームで吸っていくというやつですね。ね、いうものもあるし、よし、他にもこれか、これはこうあります。
Of the 1 million heart attacks that occur in the U.S. every year, 375,000 are ST elevation myocardial infarctions, involving large coronary thrombi that are eligible for thrombectomy. In addition, each year over 200,000 patients with peripheral arterial disease are in need of clot removal. Rapid and complete removal of arterial clot from either coronary or peripheral arteries can potentially salvage tissue, improve clinical outcomes, and reduce mortality. Unfortunately, existing thrombectomy devices suffer from major limitations. Simple aspiration catheters often leave 30 to 50% of the clot behind. Multiple catheter exchanges are needed when large clot is present. In addition, mechanical thrombectomy devices are associated with a high risk of adverse events, particularly distal embolization. Fragmentation of the clot during thrombectomy frequently occurs, sending hundreds or thousands of emboli distally, which leads to reduced blood flow, tissue death, and significant morbidity and mortality. The Megavac vacuum extraction thrombectomy system solves limitations of existing technologies, setting a new standard in clot removal. The Megavac is actually 4 devices in one. It occludes the artery completely. It protects against embolization. It acts as an anchoring device, and it rapidly, completely, and efficiently removes arterial thrombus. Let's watch how Megavac vacuum extraction thrombectomy works. The catheter is first positioned just proximal to the clot. The funnel mouth at the tip of the catheter is then deployed, occluding blood flow with a silicone elastomer on the distal aspect of the funnel. This results in the mouth of the funnel tip being maximally expanded in a radial fashion by the patient's own blood pressure, creating a seal against the arterial wall and arresting blood flow. Cessation of blood flow prevents clot fragments from traveling downstream, greatly reducing the potential for distal embolization. The patient's blood pressure, along with the radial force of the funnel tip, combine to press the device against the arterial wall, anchoring the catheter firmly and safely. The outward expansion of the Megavac anchors and centers the device and can be used as an anchor for other devices in crossing tight lesions or tortuous vessels. Once the medevac arrests blood flow, the thrombo wire is inserted through the catheter, advanced through the clot, and deployed distal to the clot. While applying suction with the medevac, the thrombo wire is retracted to simultaneously pull the clot into the funnel mouth and through the catheter. After complete clot removal, suction is discontinued and the catheter tip is undeployed, restoring distal blood flow. Rapid removal of occlusive thrombus with vacuum extraction can accelerate door-to-balloon time and improve outcomes. In summary, there is currently a large unmet need for rapid and efficient thrombus removal in cases of coronary and peripheral arterial thrombosis. The medevac system provides a 4-feature solution in one device: occlusion, protection, anchoring, and removal. Medevac is easier to use, with the potential to be safer and more effective than current devices, which translates into improved blood flow, less tissue death, and more patients' lives saved.
っていうデバイスとかね、various devices is now developing. ということで、this is the first part ね。Next is medical treatment, second part で、bypass grafting. Bypass grafting is a medical surgical operation. So therefore the chest is opened and then the stabilizer is put on the heart and then some graft, some bypassing operation is made. So the off-pump coronary artery bypass, it is set. Stabilizer, this kind of two fork devices pushed on the heart to reduce the movement, and then this part is new, some bypass the coronary artery is attached to this. 何か見ますか?
To begin the operation, a 6 to 8 inch incision is made in the chest and the sternum is split down the center. A retractor is inserted and used to further open the space created, revealing the thin layer of tissue covering the heart known as the pericardium. Another incision is made and the pericardium is secured out of the way, providing the surgeon with a clear view of the heart to perform the operation. During bypass surgery, the heart is cooled and stopped. In order for the patient to continue receiving oxygenated blood, the heart is connected to the heart and lung machine, carefully monitored by a technician at all times. This pump filters and oxygenates the patient's blood and recirculates it through the body. Typically, the greater saphenous vein from the patient's left leg is used for the bypass. And with groundbreaking technology, this vein is extracted from the leg through a hole roughly the size of a dime. The extracted vein bypasses the blockage by connecting to the aorta and the area just beyond the blockage on the heart.
This video is showing the bypass graft is caught from the leg, but in many types of blood vessel is used to bypass grafting. So in some cases this is a leg, so lower leg is used, and also used for the blood the vessel for the lungs, and the vessel for the stomach is, and the vessel inside of the forearm is used in many cases. いや、はい、終わり。これがセカンドパートオブザメディカルトリートメント、バイパスグラフティング。ね。で、then again, another method to prevent the brain death condition. The one is one very important heart disease is this, the expanding the heart. This is called dilated cardiomyopathy, DCM. Especially the left ventricle, the muscle is become larger, and this muscle become thin. So therefore, the flexibility is lost of this heart. Only the making larger and larger. So therefore, the heart is not good enough moved. So therefore, this muscle should be released. This Dr. Batista started the cutting of these muscles, heart muscles, is started at around 1980s. In Japan is also it is started. これ見てみますか?
Lone Star Heart. Treatment of dilated cardiomyopathy with Algicil. The healthy heart performs with flawless consistency as it pumps about 2,000 gallons of blood and beats 100,000 times per day. Powered by highly specialized muscle cells, the heart's chambers and valves work in tandem, as shown here, to circulate vital blood. However, this normal pumping capacity decreases significantly in patients with congestive heart failure, when the muscle cells are damaged and impaired by underlying conditions such as an infarct, atherosclerosis, or high blood pressure. Trying to compensate in reaction to the damage, the weakened muscle wall around the left ventricle is subjected to much more stress. With increasing stress, the wall dilates, stiffens, and becomes thinner. Pumping harder but less efficiently, the ventricle continues to enlarge and the heart takes on an abnormal circular shape. To stop and reverse this disease progression and reduce stress, Lone Star Heart has designed a novel biopolymer-based therapy for the treatment of congestive heart failure that can be used in a less invasive or in an open surgical intervention. The procedure begins with the determination of the area of greatest stress along the enlarged left ventricle. Typically, this area is located at the midpoint of the ventricle along a perpendicular line. The circles indicate this line and the sites where the biopolymer will be delivered. Next, adequate access to the heart is created. In the surgical setting, this is accomplished through the sternum or through an opening in the rib cage. For delivery, the biopolymer, which has the consistency of a thick gel, is placed in a syringe that is connected to a special needle and optional tubing. As it is injected into the muscle in predetermined quantities, the biopolymer gel hardens somewhat to form a mass or a body that immediately thickens the wall. The inert implantable biopolymer is highly compatible with the local tissue, and its consistency is such that it does not interfere with the beating motion of the heart wall. However, in aggregate, the injected materials have the ability to reduce ventricle size and modify the abnormal circular shape of the dilated left ventricle. As a result, the treated ventricle, shown here next to a normal heart, acquires a more normal shape and thickness. The consequence is a reduction in stress, an improvement in pumping efficiency as shown by ejection fractions, and a stabilization or reversal of disease.
This method is using some gel-like liquid is contained in this muscle wall, and then this becomes more normal sized. So therefore, it makes the damage weak. という方法でした。はい、ということで、バティスタオペレーションは started today, but it is not covered by insurance, so therefore the これがサバイバルレートとかです。で、another method is therapeutic hypothermia for brain injury. So if the brain damaged, the total very difficult to treatment. It is sensitive about treatment because sometimes the blood is not good enough provided, and but the oxygen must be provided. So therefore, sometimes oxygen should be supplied to keep the blood flow. But sometimes the oxygen consumption should be decreased. So therefore, this kind of treatment is very sensitive. To reduce the brain damage, many drugs should be provided. But one method is total body should be the lower temperature by using the cooling mat or cooling blanket should be covered on the patient body like this. By using this water cool type blanket should be covered to the patient, and then the total body activities become lower. So therefore, the patient blood is not works well, but the condition would be kept. And by natural treatment, by natural recovering activities by patient himself, therefore it waited for the 2 or 3 days, about 2 or 7 days, by using this hypothermia therapy. And during this, natural recovering activities is made by himself, and then after that, keeping its conditions. After keeping the conditions, the rewarming its body. But rewarming during the rewarming, it is most sensitive to, because some of the various defensive functions is restarted. So therefore, and also the skin pressure, skull pressure is increased, and also the infection or other, for example, blood clot making is that we have to take care. ちょっと見ますか?
When the heart decides to not function correctly and we need to do CPR in order to get it back beating normally, we have decreased blood flow to the brain. And that's when people become anoxic, they don't have enough blood flow to the brain, and it can adversely affect their brain function forever. So by using therapeutic hypothermia, we are slowing all that process down, slowing down the metabolism for a full 24 hours, and then rewarming slowly to allow the brain to restart and hopefully come back to its normal functioning state. We try to get them cooled rapidly within 4 to 6 hours after they've had return to spontaneous circulation. That's the first phase, which is the induction, which goes very quickly. And then the maintenance phase is the second phase, and that usually lasts 24 hours. We do keep somebody chilled at 33 degrees Celsius for 24 hours. Following that, we start a 16 to 20 hour rewarming phase. We rewarm slowly because that seems to help the brain slowly recover after it was without oxygen, which all was involved with the cardiac arrest. If we receive a patient from a different unit in the institution or from outside the institution, routinely they have already been started with a little bit of cooling down by having ice packs placed under their arms, up around their neck. We also give 2 liters of ice saline over a 30-minute time frame, either through a central line or through an IV line. We apply the pads, and there are 4 pads that are placed on every single patient. We have 2 pads that are placed on the upper torso. It goes from the spinal column in the back and wraps around the front. Then we also have 2 pads that are applied on the patient's thighs. If the individual has a rather large abdomen, we want to try to cover as much skin as possible to cool as rapidly as possible. So we do have a universal pad that we can use as well on somebody with a rather large abdomen. Those pads then are connected into the Arctic Sun machine. We do turn the Arctic Sun machine on, and we can set it for hypothermia. And right away, we will start having chilled water moving into the pads. And it's a constant fluctuation and moving. It should be around 33 degrees once the patient reaches its maintenance therapy to maintain them at 33 degrees for 24 hours. once we have a patient back up to 37 degrees Celsius or 98.6 degrees Fahrenheit, the recovery phase then really starts for the individual. We have seen a variety of success stories through somebody waking up and responding to our request soon after we have them warmed. We have had individuals 2 weeks out. That, not that we were losing hope, but it was really a struggle because we weren't seeing a lot of interaction, and suddenly people will open up their eyes and they do respond to our requests. So it's very individualized.
インディビジュアル。はい、でした。ということで、リカバリーの、example は this kind of です。This kind of data is provided. さて、the final part. To move to proceed to the final part, regenerative medicine. What is regenerative medicine? The transplantation in the cell level. In some cases, the cell is inserted into some part. For example, the brain, some part is the heart muscles, or some part is some joint or ligament, or some part. Some stem cell or the percutaneous cell is inserted the damaged tissues or damaged part, so to repair. And in some case, the tissue engineering, some tissue, some organs is made by using these technologies. To realize this, the source cells is necessary, and also the scaffold. Scaffold means some three-dimensional structure to generate these cells to become the tissues or organs. So therefore, some source cell, scaffold, and then the environment. Environment means some chemical environment, some stress environment, mechanical environment, some tuning adjustment method should be considered, should be developed. But this is very important subject. Which kind of environment should be prepared, should be provided to this tissue making. なんか見ますか？ちょっと短そうです。Regenerative tissue これ大丈夫かな？ダメだ。このパートダメだね。はい。これですか。
There's so much on the horizon in regenerative medicine that's exciting that it's actually hard to answer that question with one specific thing. But the areas that we're most excited about are two areas. One is called endogenous stem cell stimulation, where we're trying to promote the endogenous stem cells, for example, in the brain, to stimulate them after stroke to promote tissue repair and functional recovery. And we're looking at this through a drug delivery strategy, a minimally invasive drug delivery strategy. The other area is around stem cell transplantation. And one of the big challenges with stem cell transplantation is that most of the stem cells die after we've transplanted them. So what we're really excited about is creating a microenvironment for the stem cells so that when we transplant them, most of them, or more of them, will survive. And more of them, again, will integrate into the neural circuitry to promote tissue and functional repair. And so our lab is really focused on the central nervous system, and one of the reasons we're focused on the central nervous system is because there's really nothing other than...
彼女は、セントラルナーブシステムのそのナーブティッシュというのにイントレスティゲーム。はい。というわけで、they started from the 1981. Firstly, the skin tissues is successfully regenerated by using some Charles flat two-dimensional skin tissue will be generated. And also Natural Science Foundation is started the workshop. And then the Bacanti brothers and Ranger is made the ear. This is very exciting event about this tissue engineering. So you may know about this mouse. ね、このマウスのところに ear is developed. This is called ear mouse. 1985. The BBC is broadcasted this documentary, and USA 3 scientists is developed. はいです。で、ちょっとこれ見たいですか？これはマウスイヤーズ。ワーニング。
1997, Boston, Massachusetts. At first glance, it seems impossible. Yet, like something out of science fiction, this animal may actually become a trailblazing hero. American scientists have successfully grown and attached a human ear onto the back of a mouse. The ethics are controversial, though many believe this is horrifically cruel to the animal. Others see an amazing breakthrough that could save lives. How was such a feat accomplished? It's the brainchild of doctors and brothers Charles and Joseph Bacanti and a team of researchers at Massachusetts General Hospital. Scientists initially believed it was impossible to graft and grow anything more complex than simple human tissue onto another living organism. That is, until now. Intricate and highly developed, an ear is the most difficult cartilaginous tissue to reconstruct. Yet the team has found a way. They start by recruiting the help of specialized mutated mice. As this video shows, this mouse has no hair, and inside its wrinkly pink skin is a body without a functioning immune system. Such a mutation will assure the mouse's body will accept the foreign human ear tissue. To create the ear itself, the scientists carefully insert skin cells into a highly specialized mesh-like ear mold. Once it's complete, the mold can be grafted onto the mouse. As these images reveal, the laboratory mouse-grown ear gives great hope. Though the ear doesn't function as a hearing organ, it's a perfect living replica. If this is possible, doctors believe similar mold transplant technology may one day work for humans, helping people regrow their own organs, repairing deformities, or even for life-saving transplants.
というのが、まあ、これイヤーマウスというのはベリーフェイマス。これね、イヤーマウス。それからまあ、なんだ、アーティクラーカーテリッジとか、In Japan is also promoting this kind of regenerative project. And then the ES, embryo stem cell とか、embryonic stem cell とかで、vascular cardiovascular is this clinical application is succeeded and so on というわけで、ちょっと待って、これが再生これかというわけで、ティッシュエンジニアリングはこのセルカルチャーリングテクノロジー and material engineering plus the medical engineering and so on. So therefore, the some tissue or some organs is developed, produced. So the matrix, three-dimensional matrix, three-dimensional structure as a scaffold, and then this kind of control method, physical control, physical stimulation, chemical stimulation, or some the active agent providing. The combination of these, some organ or some tissue is formed. So therefore, the scaffold, the foundation to develop, and proliferation to the source cells as a stem cell or other cells, and then the adjustment, how to develop this. how to stimulate is very important subject. これなんか見ますか？例えばティッシュエンジニア。
Toshi and I first met in the mid-1990s. At the time, nobody was performing research in the field of cardiovascular tissue engineering, and I thought there might be some promise. We're particularly interested in trying to develop new technologies and techniques for treating children born with congenital cardiac anomalies. It turns out that when the surgeon repairs a child with a congenital birth defect, that one of the problems they're often concerned about is the child outgrowing the operation, just like they can outgrow their shoes.
In small babies, if we use the foreign body materials, that materials never grow. So material has to be replaced every 6-7 years.
Our goal is to move away from surgeries that are simply palliative, surgeries that are designed to help a child but not cure a child, and actually move into the realm of curative heart surgery. In tissue engineering, we can take an individual's own cells and seed them onto a three-dimensional biodegradable substance that we call a scaffold. And the scaffold provides sites for cell attachment and space for tissue to form.
The graft scaffold is designed to be absorbed within the body within 2 months. After the scaffold degrades completely, only the functioning blood vessel remains.
And from a surgical perspective, that's really exciting because as a surgeon, if we have enough tissue, we can fix many, many more problems than we currently can.
Angela has a very severe heart disease. She has a single ventricle instead of the 2 ventricles.
I think over the next 5 years, we'll have a fairly robust clinical trial in the making. We think that there will be a variety of different tissue-engineered vascular products that we will be testing for the first time in the United States here at Nationwide Children's Hospital. I think that...
まあいいや。ということで、especially for the children, some artificial vessel should be replaced every 6 years, he said, because she become growing, so the body is become larger, so therefore the vessel should be larger. So therefore the artificial vessels for the heart should be replaced after some years. So therefore this kind of degenerative tissue, degenerative blood vessel is better than artificial vessels, they say. はい、というわけで、the stem cell is required to make some tissues, some artificial tissues. まあ、ES cell, EG cell, or somatic stem cell. Okay. How do stem cell work? っていうのを見ますか、じゃあ BBC。
Now, imagine this is a stem cell. Stem cells are unique because they have the ability to generate new cells of almost any kind. They all start off as unspecialized cells. But given the right chemical and genetic signals, the stem cells can divide to form slightly more specialized cells of different size, shape, and function. And after a few more cycles of division, these can give rise to highly specialized cells, like heart muscle cells, for example, that help your heart pump the blood around your body. Given a different set of signals, this same unspecialized stem cell can go down an alternative pathway and give rise to a different type of specialized cell, like a neuron that transmits electrical signals in the brain. Compared with stem cells from embryos, adult stem cells give rise to a smaller number of cell types, usually those of the organ or tissue in which they're found. Now, researchers have found adult stem cells in more tissues than previously thought. Bone marrow, skin, brain, liver, eyes, and this has led to research into using the patient's own adult stem cells to repair damaged organs. And that's exactly the focus of the trial Michael Taylor is taking part in. Led by Professor Anthony Mather at the London Chest Hospital, the trial is vitally important because heart disease is still on the rise.
Cardiovascular disease is the #1 killer in the UK, with nearly 3 million people suffering with heart conditions in the UK, and about 800,000 people suffering with this condition of heart failure. He's got a condition which makes the heart very weak and baggy, and it doesn't work very well as a pump. And what we're trying to do is see whether his own stem cells can actually repair that heart and make it pump effectively again.
So if you're looking to repair heart tissue, do you need to use heart stem cells?
Ideally, yes. The problem is that there are very few of those cells in the heart, and we've only recently discovered that they're there. And the few heart stem cells that are present clearly aren't capable of repairing it. And that's really where we step in with our trials, that by using bone marrow as a source of stem cells, we try and enhance the stem cells in the heart and their ability to repair the damage that's been caused.
This trial tackles heart disease on two fronts. Michael's bone marrow has already been stimulated to release enormous numbers of stem cells into his blood. And now, more are to be harvested directly from the bone marrow in his hip.
You okay?
Yeah, well, thank you. Yeah, it wasn't that bad at all.
Good.
As this is still a trial, only some patients will have these stem cells re-injected. Although Michael will get an injection directly into his heart, neither he nor Professor Mather know if it will contain his stem cells or a placebo.
We're about to put either stem cells or placebo into his coronary arteries. We won't know which until the end of the study when we've treated all of our patients.
This uncertainty helps the researchers to rule out the placebo effect from any positive results they achieve. Professor Mather feeds a tube through Michael's blood vessels right to the site of the disease in his heart. Incredibly, Michael remains fully awake throughout the entire procedure.
All right, mister? This one, thank you. Can't feel anything?
No, not really.
まあいいやということで、こういう、ソマティックセル、ソマティックステムセルから from other part of the body, some stem cell is picked up, and then it is changed by using some stimulation, and then it is planted into the weak tissues or organs. The EG cell is provided from the aborted child or dead child or some part, but the somatic stem cell is harvested from himself. So therefore, it's more better way to do that. はい。というわけで、これがエッグから divided into some specialized stem cell, and then it is more specified, and then become bone or the heart muscle or some part like this. で、3-dimensional cultivation. Firstly, only by using this channel on this plate. So therefore, firstly, the skin is made from this channel, but presently, more 3-dimensional organ tissues is preferable. So therefore, this kind of scaffold is made, and then the cell is provided in here, and some stimulation is given, and then make some tissues. So this kind of process is now under development. Now, so これはまあいいか。はい。 で、あとは many kind of under investigation, many kind of cells, many kind of organ is now under investigation. So the cultivation or seeding, propagation and provided. はい。で、まあイヤーマウスがあって、で、まあスキン、こういうスキンですね。Partly the skin is developed on this kind of seed-like the skin tissue is developed. And then this is a lung system, lung とか、あるいはここはnerve cell is made. ちょっとどっか見てみますか、これ。キートニーですか。
My name is Shulo Roy. I work in the Department of Bioengineering and Therapeutic Sciences in the Schools of Pharmacy and Medicine at UCSF. I am working on the development of an implantable bioartificial kidney. Chronic kidney failure or end-stage renal disease as it's known affects over 500,000 people in this country. It's growing at about 5 to 7% every year. It's growing because of the obesity epidemic. People who have chronic kidney failure need dialysis to survive. Unlike the native kidney, dialysis does not provide all the other benefits that are required for health. So the people that have chronic kidney failure and are on dialysis are never healthy. The implantable bioartificial kidney that we are developing will provide most of the functions of a kidney transplant. This device will be implanted in your body and provide both the toxin removal as well as the biological activity that's required for health. Our device consists of two basic chambers. A hemofilter basically filters the blood, removes the toxins, takes out excess water and all the excess salts. In the cell bioreactor, we've got renal proximal tubule cells that basically reabsorb much of this water and salts back into the bloodstream. What they don't do is reabsorb the uremic toxins, so toxins don't get back through. The other function the cells do is to activate vitamin D and also some of the immunological protection that the kidney cells provide in a healthy body. The excess water, toxins are then passed through a port into the waste outlet, which is connected to the bladder. There are certainly challenges that we have had to overcome. Fundamentally, we have had to wait for the state-of-the-art in silicon nanotechnology to be able to provide us the membranes that is required for our device. The beauty of the silicon nanotechnology is that we can create super efficient filters. The filters are so efficient that the device operates on blood pressure alone. The implantable version of our device will be the size of a small coffee cup. Unlike dialysis, our device will provide continuous therapy 24/7. The patient will have complete freedom of mobility and, in addition, will be able to avoid the challenges of transplant.
ということで、キドニーって very preferable というか desired many patients from many patients. はい、キドニープロジェクトは many organizations is doing this kind of techniques. And the brain nerve cell とかベステルセルにはプランテーションが it's also did. The aborted body's brain cell is transplanted into the Parkinson's disease patient. And also the patient own vascular cell is planted, and then so this is also the small children, 4 years old girl is planted in this case. And so this is not from the human. The POX hepatic cell, from the hepatic cell, this kind of the gene is tuned, and then this PICS cell, hepatic cell, PICS hepatic cell is transplanted into inside of is replaced into these modules. But some kind of retrovirus is dangerous is there remaining. But this kind of method. But this kind of transgenic organ is underdeveloped from other animals like dogs, chimpanzee, or baboon, pigs, mouses, or other. And then the pigs is the most used because the size of the heart, size of the liver is similar to the human beings. So therefore the pig's organ is tuned, or the pig's heart valve is also used. ちょっと例えばビクローンスのオルガンインピックとかいうのを見てみましょう。
Hi, this is Kate from Minute Earth. In the United States alone, 22 people die every day waiting for a kidney, liver, heart, or lung transplant. There simply aren't enough donated human organs to go around, and we can't just go around stealing them out of random healthy people. But pigs' organs have roughly the same structure and proportions as human organs, and we already kill 500 million of the creatures every year for food. So why can't we just use their organs? Here's the thing. Our immune systems are really, really good at seeking out and destroying anything foreign to our bodies. So even human-to-human organ transplants sometimes get rejected. And pig organs are much foreigner. They have a super conspicuous sugar molecule on the surface of their cells that's basically a fight me sign for humans' organ-rejecting antibodies. But we've actually been able to engineer pigs whose organs don't carry those sugars. So, assuming we could take care of pig organs' other fight-me signs in similar ways, we might one day be able to transplant pig organs into humans. But there's a far more radical idea for pork-based organ farming. Grow customized human organs in pigs. Actually, it's not just an idea. It's an ongoing experiment in real life. First, we engineer a pig embryo that doesn't grow its own kidneys. Then we inject it with stem cells from the person needing a transplant. Then, as the modified pig embryo develops, those human cells grow inside the incubator into healthy kidneys made from the patient's own cells. At least, that's the plan. So far, we've only seen this experiment all the way through when the modified pig embryos were injected with stem cells from other pigs. We don't know whether it'll actually work with human kidneys because we've halted all experiments with the pig-human embryos after just 4 weeks of development because some of those human stem cells could develop into other human organs elsewhere in the pig's body, which raises a lot of ethical questions like what to do with them. Even if the cells don't migrate and these hybrid pigs end up producing lots of life-saving organs, what rights do we give to a part human pig, even if the part is just a kidney? What if it's 2 kidneys? 2 kidneys, a liver, and a set of lungs? In principle, we could use the same technology to grow human hearts, human spinal cords, and even human brains, all inside of a pig. And when we do, how will we know if that pig is still a pig? This episode of Minute Earth is sponsored in part by Tab for a Cause. If you're like me...
ということで、okay, pig. Inside pig, this kind of transgenic organ is the gene is recombined with human. Human gene is provided inside of the pigs, and then it will be used for some replacement for the human organs. Now, こんなもんですか？はい、いいですか？That's okay. Today's